Last time, we talked about hepatitis, and the response was overwhelming. Views skyrocketed, inboxes flooded, and the questions didn't stop. We've been listening closely. From questions about how to get the vaccines and transmission, it's clear that people want more information, something more to use. We hear you and we understand. That's why we're back to ensure everyone gets the answers they need and deserve. So welcome back to Untangle, where we go beyond the headlines and get to the heart of what you really want to know. In this special follow-up episode, we're answering the burning questions you sent us, from transmission myths to treatment realities and everything in between. If you watched part 1, you'll want to stick around. And if you're new here, be prepared. We're about to clear the confusion. Welcome once again. I am Amadin Ogbewe. All right, welcome back. Joining us once again, after doing such a great job the first time, is Dr. David Uzochukwu. He's a medical doctor, an hepatitis expert, and also an HIV expert. Welcome to the program.
Thank you very much.
Welcome once again.
Thank you very much.
Good to have you. I'm sure you've gotten your fair share of
questions. My DM was flooded.
Wow.
You know, there are a lot of questions, as you said, and I kept repeating myself. So I felt, of course, there's a need for us to address this question holistically and, let people get better understanding.
Indeed. So let's go straight into it. I'm just going to be reading out the different questions people had from our comment section and from across all pages. So the first one, what are the effects of getting the vaccine as a pregnant woman or a breastfeeding mother?
The vaccine for pregnant women is safe. Studies have shown that it is safe. Of course, it poses no risk, of course, to the child or the baby or the unborn child. And of course, we do this sometimes when you see a pregnant woman who was negative at the clinic, but all of a sudden, because of pregnancy, she came into the clinic and saying, "Oh, my husband is positive." What would you want to do at the time? You want to protect the mother at that time. So yes, it is safe, no effect on the unborn child.
Fair enough. So I guess, which follows to the next one. Can hepatitis be transmitted to an unborn child? Assuming this is not someone who has taken the vaccine, the pregnant mother has it. Can she transmit it to the child?
Now, you're talking about a pregnant mother who is positive to hepatitis B.
Yeah.
If you notice, pregnant women, when they go for antenatal, they usually subject them to some antenatal screenings. Hepatitis B, HIV, hepatitis C, they are all parts of it. Why we want to do this is to identify those mothers, those pregnant women who are positive. And of course, advise them to provide what we call the hepatitis B immunoglobulin. If the hepatitis B can be transmitted from the mother to the child during the course of pregnancy, no. But it can be transmitted to the baby at birth. You know how bloody the birth canal can be, and subjecting the baby to hours of birth and some birth trauma and blood, the child can be infected. Now, if the mother was positive, the doctors knew, the mother knows, there is always hepatitis B immunoglobulin that will be given to the child at birth. That doesn't mean that the child will not still go on with the scheduled immunization plan. The child will still take the vaccine at birth, still take at 6 weeks, at 10 weeks, and at 14 weeks. The standard. But it cannot be transmitted during the pregnancy, but during the birth process, yes, it can be transmitted.
And that immunoglobulin, is that what you called it?
Immunoglobulin, hepatitis B immunoglobulin.
Yeah. What is it doing? It's protecting the child?
Okay, let me put it this way so that the viewers can understand it. It's already built soldiers that can defend and mop up those little ones that get from the mother during birth, right? So that mops it out and it gives the child a better, because when the child is born, he doesn't have immunity. The immunity he has or she has is from the mother, and that covers for like 6 months after birth, right? But this mother is already positive. She doesn't even have immunity. So we have to get you an immunity that would protect you. That's why that hepatitis B immunoglobulin is very, very important. Let me tell you this. Children who get infected at birth, 90% of them, because the immunity is not there to fight and defend them, 90% of them will move to the chronic phase. 90% of them. And by the time they're getting to 40, 45, they start coming down with all sorts of liver complications.
All right. That really clears up that question. Still on the issue of birth, you've already mentioned the vaccine schedule. This person asked, if the vaccine is given at birth, will it be effective during youth? I guess what they mean to say is not the usual giving of the vaccines from birth. Does it last throughout your lifetime? Does it protect you throughout your lifetime?
No. Our guideline says we should give about 3 to 4 doses from birth, for children, and they are all given 0.5 mils of the vaccine compared to adult dose of 1 mil. Right? So you can see they're trying to give it in bits, to build your immunity. Yeah, but that covers for about the first 10 years of your life, maybe 12. Once a child starts getting to secondary school, we start advising that you start taking the adult dose, which is 1 mil. I'm not saying that you don't have some degree of protection, but it's just to boost the immunity and to reinforce it.
All right. I guess we've already naturally asked.
But you have to be screened first. What people usually ask again is, can someone who is positive take the vaccine? No. Someone who is positive cannot take the vaccine. You're already positive. The vaccine is to prevent the infection and not to treat the infection.
Fair enough. That clears it up. But just to ask, perhaps someone who is even a senior citizen decides they want to take it.
Of course.
Okay. As long as they're screened first.
Of course, they screen and they are negative, they will now be subjected to take the vaccine.
All right. So how can hepatitis be prevented, especially when you live with someone who is hepatitis positive?
A lot of people, it's still part of this myth we talked about the last time. And I asked my friend, or a patient who came to see me, I said, what if your mother was positive at birth? You were lucky enough, you got the immunoglobulin at birth, you are negative, you took all your vaccines. Won't your mother cook for you? Won't your mother take care of you? Once the myth here is, people get scared. Hepatitis B is a vaccine preventable disease. If you notice one of your siblings is positive, first thing to do is to call everybody, get everybody screened. Let's know who else is positive in this house. When everybody has been screened, those who come out negative should be vaccinated. And the ones that are, unfortunate, of course, positive, those ones will now go for treatment. The doctor wants to see if they are qualified for treatment. They want to evaluate them first. All those tests I discussed with you, they want to evaluate them first to see if they qualify for treatment, if they are active, if they are inactive, are they posing risk to these ones. But the truth is, once you are vaccinated, you can live, marry anybody who is positive to hepatitis B because you are protected already. That is why we said the disease is a vaccine preventable disease. You shouldn't be scared. However, because you know that this person is positive, and sometimes you don't know who comes to the house that has taken the vaccine, for instance, there are some personal hygiene tips that this person who is positive should engage in. Not because you know that everybody in your house has taken the vaccine, you should now start exposing yourself and your blood to anything. You're popping pimples, or you're allowing people pop your pimple when you know blood is going to be on your nail bed at the end of the day. And you see some people, they will put that nail or that finger in their eyes, cleaning their nose, cleaning their eyes, you have transmitted the infection. Remember, I told you that the infection can be transmitted through body fluids, blood especially, semen, vaginal discharges, vaginal fluid. Yes, there are stories about saliva, right? But I will address that later. Hepatitis B, yes, I've been seen in saliva, right? But casual kissing has not been recorded as a means of transmission. However, the toothbrush we use in Nigeria these days, I don't know where they get this toothbrush from. Most times when you brush, you tend to bruise your gum. So now there's a break in your skin somewhere in the gum. There's an opening. There's blood somewhere. And if that person is positive, for instance, if that person is positive and the person has a date that day to go and see a lady, and the lady too knows that she's going to have a French kiss with this guy, and the lady has also brushed, and there's a cut. Now ask me, if they meet and have that French kiss, there will be exchange of fluid, exchange of body fluid, blood even in the saliva. That person can get hepatitis. But casual kissing, when there is no cuts, there is no blood, the person cannot transmit.
Okay. Fair enough. Thanks for really breaking it down there. I think those who have people around them who have the disease now know how to move. And then the people who actually have it as well should also take care.
Let me add to that.
Okay.
Now, even in the family, so what you do is you cannot be sharing toothbrush with that person who is positive, right? Because I just use toothbrush as an example, right? Because of course, toothbrush has some of your tissues on it, right? And some blood on it, and you know how you keep your toothbrush and we know that the hepatitis B virus is so virulent, and the virus can stay up to 10 days on a wet surface outside the body. It can live up to 7 to 10 days. Imagine you have it on your toothbrush and someone who has just come visiting, or a younger cousin, or hey, let me go and use your toothbrush, and still use it. You can transmit it through that means. So basically it's just hygiene. Now for hepatitis C, we talked about hepatitis B.
Yeah.
Someone who is positive to be living with people who are not positive. Now let's go back to hepatitis C. For hepatitis C, that we know that we don't have vaccine. The case is different. So what we do, once you identify someone is positive to C in the house, what we want to do is to do a confirmatory test. Again, gather everybody, screen them, identify those who are positive, and those would have to be isolated. Why? Because you have no measure to protect yourself against them. Correct?
Yeah.
So what you will do, because we know that this hepatitis C can be cured, they are isolated, being evaluated to know if they are really positive, done a viral load, and even done a genotype, because hepatitis C has different genotypes, about 6 of them, 6 genotypes. And they also have subgenotypes. Anyway, let's leave that. But because you know that it is curable, they will go and receive treatments and get cured before they are now back into the house. 2 different scenarios. 2 different approach. Hepatitis B has its approach, hepatitis C has its own approach.
Fair enough. What about A and E?
No, A and E, as I said, they are self-limiting viruses. You can take the vaccine for A, as I said. There is vaccine for hepatitis A. So if someone has hepatitis A in the house, yes, it can be transmitted, just like, but of course through contaminated water and food, like I mentioned in the last episode.
All right. Fair enough. So let's go to the next question here, which is it hereditary? This goes back to the earlier question. I'll just combine it now with maybe a question coming later, which is that if, say, a pregnant woman, she is negative, she doesn't have the virus, but her husband does, is there any chance that the child gets it? So which goes to hereditary?
No. No, hepatitis B is not hereditary. It is not hereditary. Not because your father has it, you will have it. You can be protected. Like I said, the vaccine only got to Nigeria in 2004, 2005, where it was integrated into our API, right? So, of course, if a pregnant woman comes and a partner, the pregnant woman maybe would have known that the husband is positive and must have taken the vaccine, because that's what any reasonable person should do. Once you know your partner is positive, or your sibling or someone close to you is positive, that is the main reason why you should get yourself screened and get yourself protected. Right. Because you cannot cut off from the person.
Indeed. So to more policy and government related questions. In Nigeria, there's meant to be a national directory for all where vaccines can be gotten and the places. Is there an updated one? Because what we hear of is perhaps from about a few years past. And what health facilities can patients go
to get vaccines?
For care and vaccines, yeah.
I think every primary healthcare center should have the vaccines for the populace or the community. Every hospital, private, government, should have vaccines. Because especially if you are providing vaccination, services, because of course we know vaccines are cold chain products. They need to be in a cool area. They need to be in refrigerator. They have refrigerator designed to storing vaccines, so that the active ingredient doesn't degrade. So yes, most centers should have. I don't know if all primary healthcare centers have, because of course, some challenges, infrastructural challenges, so talking about lights, talking about this, how it's stored. But yes, they should have. All government hospitals should have, be it tertiary, be it secondary, be it primary, should have. Vaccine can be gotten from anywhere. So far, it is a licensed hospital, and you just discuss with the nurse or the matron, you discuss with the healthcare provider, they will make it available for you.
And if they don't, they can at least refer you.
They can refer you.
Right. Fair enough. And there's a national guideline for hepatitis in Nigeria. Has it been updated in 2023? What can you say about it? What it entails?
Yeah, the national guideline, there is a body that is in charge of this. I know we're part of these guidelines in 2020. I think the first one was in 2015. I don't know if it was the first one, but I know I was part of that team. And another team, again, there was a review in 2023, updated. Basically, it's just a national guideline on the management and treatment of chronic hepatitis B and C. What do you do when you see a case?
This guideline, is it for the health sector? Or
it's for the health sector. Right. It's to basically, because in 2017, if I'm right, the stakeholders in the hepatitis space, now in Ministry of Health, there's a department called the National AIDS and STIs, that sexually transmitted infection control program. It's a department that oversees all issues of STIs, including hepatitis B and C and HIV. A wonderful team they have there. And they came together with other stakeholders like the doctors, Society of Gastroenterologists and Hepatologists in Nigeria, as in that 2017. And the WHO was involved, I think. And what the resolution of that meeting was, they were trying to see how they can decentralize the care of hepatitis. Why and how? What the problem was we had an overwhelming number, about over 20 million individuals who were infected with chronic hepatitis B and C. But we had few doctors at the time. In fact, they developed a directory of all the gastroenterologists in the country at the time that were available anyway, and made a directory of them, the hospital that they work, their email address, their phone number, so that it would be easy for someone who is in Kafanchan to say, okay, I can access this doctor in this area, in this hospital at this time.
So is that directory available to the public?
Yes, the directory is available. I don't know how you can get it. Maybe it's on their website. I don't know if I have their website, but I would get questions on that as well. But yes, the directory is available. I used to have a hard copy of the directory. I'm friends with some of the gastros and the pathologists in Nigeria. I have some of their contacts. So basically, that's how we want to do it. Decentralizing the care is what that meeting I was telling you about was to see how they can decentralize the care where every medical doctor, not necessarily a specialist, not necessarily a gastroenterologist or a pathologist, should be able to at least manage uncomplicated cases of chronic hepatitis or acute hepatitis in Nigeria. Just like how any physician, any medical officer, or even pharmacists, even med lab scientists, they have knowledge of managing high blood pressure, hypertension, diabetes. So they are trying to do the same thing because we have few doctors who were specialized in managing this disease. With the disease burden, we couldn't address it. Because what we see, again, let me add to that, what we see in the hospital is a lot of people come to see the specialist, right? And there is a long queue and people get frustrated waiting. And somebody in their village in Jos is telling you, there's this agbo that can cure it. This doctor is wasting my time. And when you eventually see the doctor has given you some investigations to go and do that you ought to have done maybe 2 weeks, 3 weeks before coming to see the doctor. And at that time you're coming to see the doctor, you're supposed to be doing interpretation and looking for way forward. Now the doctor is giving you investigation to go and do that would take, like in some places, the viral load takes up to 2 weeks, 1 month for the result to come out. Someone who is curious or someone who is anxious with this disease information would go and start looking for alternative method. Now, by the time they go, they start taking this Agbo native medicine and they get some complication. That's when they start coming back to the hospital. When you start coming to the hospital, you are seeing them, their liver is so swollen, they are having distended abdomen, their eyes are yellow. It has gotten complicated. Then it will be hard for them it can be managed, of course, but the prognosis, the outcome is, 50-50.
But that's what the guideline does. It makes it
easy.
So that everyone can at least begin the process.
Yes, the guideline helps all health professionals, medical doctors as well, to know what to do. When you see someone who is positive, you already know the investigations to ask. So that the results, the doctor is now using it, the patient is using it to see the specialist.
All right. So just to round up this first segment, I'll bundle some questions together. Someone is worried if there are restrictions to travel for people with hepatitis, and the other is asking if there are any other things that come from hepatitis other than liver damage and liver cancer.
Okay, first, if there are restrictions, to my understanding, I know that even to go to most of all these people traveling, they do medical before they travel, right? And hepatitis is part of what they screen. And I've not seen someone who is turned down because of that. Instead, they would request, the embassy or the agency will request that you come with a medical report from your managing physician. They want to know if you are receiving treatment, because if you are receiving treatment, fine, you can travel. I don't think there's a restriction, because there is, even in some places, there are some legal backings against discrimination of all those things. People who have HIV travel, people who have hepatitis travel, go to school and stuff like that. But I think, I don't know, maybe different embassies have their own, policies, but from my knowledge, no. And then again, if someone who is inactive, is that what you said?
No, it's about if it leads to anything else other than liver damage or chronic diseases like liver cancer.
Yes, people who are positive to hepatitis B have a high risk of renal problem, kidney issues. They have a high risk of even blood vessel issues, vasculitis. Even new studies came out and was talking about high risk of this cancer, this non-Hodgkin's lymphoma. It's It's a cancer. And even ovarian cancer. New studies are showing that. So, but yes, it can. The most important thing is come to the hospital and get yourself screened and checked regularly.
Indeed. So, okay, I guess you've already answered this question. I was going to ask if the government is doing anything to, okay, this for vaccines specifically. Are they doing anything to make vaccines more affordable? I guess some persons are even wondering, how much is it? Is it costly? Is it something they can manage?
I can tell you categorically that hepatitis B vaccine is highly affordable. I don't know the cost. I can't share that with you.
It's okay.
But I can tell you categorically, if you can buy a bottle of Coke, you can take the vaccine. If you can recharge your phone with data monthly, you can take the vaccine. The vaccines, most times, we have donor agencies that give us these vaccines for free, especially for children, not for adults. And I see some practices that, some people engage in, because children's own is given at 0.5 meals. Adult own is at 1 meal. You see some people taking 2 doses of the children, just combine to make it 1 meal. But yes, the vaccines are available either in multiple doses of 10 meals. The vaccines are available in 1 meal. The vaccines are available in 0.5 meal.
All right, thank you so much. That's how we will round up this segment of the program. I believe we've covered actually all or most of the questions asked by our viewers. We'll go on a break now, and then we'll just ask a few follow-up questions to give a more broader understanding. Don't go anywhere. We'll be right back.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. All right, welcome back. We're still on hepatitis, answers to your burning questions. Now, just some quick follow-ups. Dr. David, very quickly, a number of misconceptions and issues I want to quickly clear. There's a belief that drugs that treat HIV also treat hepatitis. Is that true?
Yes. The nucleotide, let me don't say too much. There's a drug, tenofovir, which is part of the treatment for HIV, is also what is used in the management of hepatitis B. And most times when we have co-infection, we are using one stone to kill two birds.
I think that's another important question to answer. You can't have hepatitis and HIV at the same time.
Oh, yes. I've seen patients, we manage patients with hepatitis B, HIV, and hepatitis C. The patient has the three. But the beauty about it is hepatitis C is curable. So we, first of all, treat hepatitis C first before you start treating the HIV and the hepatitis. So most of the time, you don't need to be giving the patients treatment for hepatitis B again, because the tenofovir is already inside the HIV treatment medication.
All right. You already answered about how affordable the vaccines are, but is there anything happening on the global scene from WHO, Gavi, other organizations to even make it more affordable and accessible?
For the vaccines or the
Yes,
medication?
both.
I would say there are donor agencies, and they've been doing their bits. Hepatitis B now has been getting a lot of light. And I know, with the approach of public health, you want to do something that you can eliminate as soon as possible, which we see that hepatitis C is easier for us to eliminate because 8.2% or 8.1% of our population is having chronic hepatitis B. 1.1 is having a chronic hepatitis C. Hepatitis C is curable. So you can see that most of these donor agencies are tilting, or NGOs, that are tilting into eliminating chronic hepatitis C completely. It's a low-hanging fruit, I would call it. Something that you can achieve and get results quickly. Hepatitis C, which is a lifelong management that you offer, it needs more funding.
You mean B?
B, sorry, B. B, which is a lifelong illness, needs more funding, right? And that's where the catch is. Now, in terms of vaccines, yes, a lot of donor agencies have been helping us with vaccines, and some of the vaccines are now being produced in Nigeria. The current government is trying to promote that we promote homegrown, home built, home everything, locally made pharmaceutical products to manage our patients, because that will be more sustainable. We cannot be depending solely on international donors. See what is happening in the world right now. Trump is cutting down all this. And imagine what will happen to those people who have been dependent on donors and donor agencies.
All right. Fair enough. So quickly, maybe I'll bundle some questions together. How often should people get screened? I tell you, even as we're doing this awareness now, there are people who are watching and they have a little bit of doubt, but they're saying, I feel fine and I don't want to go out there and get tested and suddenly I will have it. And then on the flip side, are there also some signs people might not, or people miss out on that might hint that perhaps I have this?
Okay, let's start with
How often?
How often this can be done. The truth is, once you screen yourself and you're negative, please don't waste that money. Go and take vaccine. Because if you've taken the vaccine is for life. For an adult vaccine, it's for life. It will protect you for life. However, you can check, because you can see some people who talk about booster dose after 5 to 10 years. Yes, it is possible for you to take a booster dose, just a one shot, right? But do you know that you can actually measure the level of immunity that you have after taking vaccine? Let me say you took the vaccine in 2010 and 2015, and this is 2025. You are now worried, you want to go and take a booster dose. You can actually check if you have immunity, still have immunity from the previous one you took. If you have enough, there's a value you should have. If it's enough, there is no need to take the booster dose. Why we even encourage people to take the booster dose? Because, as I said, the vaccine is a cold chain product, right? And sometimes you have some storage problems where there is no light, or where for one reason, something happens to the vaccine and the potency reduces. Now you are now worried about the lifetime coverage of the vaccine, So you're now saying, okay, maybe you should take a booster dose after 5 to... But trust me, the test can be done. They do the test, it's common. It's called the Hepatitis B surface antibody test, quantitative analysis. Do it.
Fair enough. But for other hepatitis, in case somebody just wants to be sure.
Yes. Now now let me say this. High risk individuals, because we have a community of female sex workers, men that have sex with men, people who, your risk, they do IV drugs. or healthcare workers or people whose job put them at risk, right? It is important. I even say this, it doesn't have to be hepatitis. It is important for you to do an annual check. Many people underscore the importance of annual check, routine annual check. If you have the funds, you can do it every 6 months. Why am I saying this? It's because now when you do tests and you find something, and the doctor needs to monitor you to know if it is going up or coming down, the doctor will have to repeat a test, the second test, and compare it with your previous result. And if you see these things early, you address it early and you get better outcomes.
All right. So the next question was any signs people might miss?
For hepatitis, I've told you that it is a silent killer. And most times people don't know they have been infected. But yes, once you start noticing your eyes are yellow, you are getting tired unnecessarily, you are having nausea, you are having high-grade fever, please come to the clinic.
All right.
Screen yourself. Screen for yourself, especially if you've not taken the vaccine. Screen yourself. But if you've taken the vaccine, you should start screening for other things and maybe other STIs.
All right. Fair enough. And for people who have gotten to the chronic phase, can they still, how much longer can they live?
I'm not God. Why are you asking me this question? How
Typically.
much longer can they live?
Typically.
With the medication, I think their outcome is way improved. Their life is better. They can live their normal life till God calls them, knowing that you are on meds. The med controls it stops the replication of the virus. Tenofovir. There's a new tenofovir. There's the old one. There's a new one. And in fact, many people are tilting to the new one now because it's more safe for the kidneys and the bones. It's called tenofovir alafenamide, 25 milligram. But of course, it's still as effective as the old one, TDF. We still use both of them. There's this one is better, but if you have concerns with your kidneys or you are elderly, or you have issues with bones and, we start giving you the new one.
All right. Fair enough. And lifestyle changes. People who have the disease, what changes? You've already spoken about what they can do to avoid, transmission or spreading. What about just living their lives? Are there foods they can't eat anymore? Can they fast? Can they exercise?
Why can't they fast, Madam? They can fast. You can live. Hepatitis is not a life sentence. People, yes, we just know that it is highly contagious, right? But it's not a life sentence. You can still do everything you need to do, but you, maybe as a carrier, should be cautious because you know that your body fluid can infect others, right? So that's the precaution. That's the caution that you need to just. But they can fast, they can exercise, they can do anything. They can eat their food.
It has to do with the liver. What about alcohol and all of that?
Now, but for alcohol, now we're getting there. Okay. But for alcohol, you need to cut off alcohol. Now, let me say this. Someone is already positive and you've done your assessment and the doctor has told you that you are inactive. You are just a carrier. You now go and start abusing alcohol. The hepatitis that was sleeping will wake up. Now, let me tell you this. 40% of people who were inactive or who are inactive can still move to the active phase. They could still be what we call reactivation of the hepatitis B virus, reactivation. And that can be so dangerous. So what you need to do as someone who is a carrier, a chronic carrier, is inactive. Okay, stop taking alcohol. Anything that will just cause problem for your liver, avoid it. But for food, you can eat your food unless you've gone to the doctor and the doctor is saying that, your liver is getting bad. You should cut down on this protein, cut down on these diets. Right.
All right. So just to round up now, just once more, you've already mentioned that basically any government hospital should have it. Other than that, is there any other advice you can give to people? Because I think the things they want the most is oh my God, I think I have it or I have it. What do I do next in terms of where to go? Is there any more thing you can tell them, or perhaps a number to call, something?
One thing that we're trying to do this year, the World Hepatitis Day is coming, it's usually 28th of July. World Hepatitis Day, 28th of July. And from the agency, from NASCAP, I know that they're planning something big this year where they have people screened. The most important thing is screening people. People don't get to have the opportunity to get screened. That's the problem. I feel that is the major problem. There are so many NGOs in the hepatitis space today who are doing their bit to have people screened. You can invite them. You can, talk to us, talk to the ministry. Even as a private organization, there are people who can offer you free hepatitis B and C screening. But of course, they will tell you, if we are screening you, you must vaccinate. Nobody wants to come and waste their screening kits for you. Why are they screening you? So that you carry your certificate and say, oh, I'm negative, and run back to the community to go and get infected? We have wasted resources. So anytime we have an opportunity to screen people, WHO says we should endeavor to vaccinate them and protect them so they don't get infected. That way you are saving resources and saving life, right? So yes, there are organizations that help with this. Of course, maybe when they discuss, we can channel them to those organizations and even invite them to come and do maybe a general screening on hepatitis B and hepatitis C screening in their facilities.
Okay, let's talk about jobs. Are there jobs that people with hepatitis cannot, perform? Or is there discrimination? We have food, we have services and all of that.
Amadine, I will be honest with you, right? A lot of HRs get it wrong. And because of, like I said, the myth around hepatitis. Now for hepatitis C, let me start with hepatitis. I want to get something cleared. Hepatitis C is an RNA virus. When someone is exposed to the virus, okay, let me put it this way. Hepatitis C is an RNA virus, right? The test we do to screen for hepatitis C checks for the antibody. The serology test, the regular screening test, just screening test for hepatitis C, which most people do during their pre-employment medicals. Checks for the antibodies. Why am I saying this? There is a difference between antibody and antigen. Unlike hepatitis B checks for the antigen. People will be asking, what's the difference between antigen and antibody? The antigen is the bad guy. The antigen is the disease itself, the virus itself that comes in, right? Let me put it for layman to understand. The antibody is the immunity that your body has built against that particular antigen. So if there are 10 antigens that come into the body will build 10 different antibodies against them. Understand this? So the antibodies are the good guys. Let's put it this way. Correct? Yeah. Now, when you remember, I told you that hepatitis C, we stand a 5 to 15% chance of clearing the virus within the first 6 months, correct? Now, if you've cleared the virus, it is expected that you should have antibodies. Yeah. Now, I've gone to the clinic. I'm engaged with pre-employment screening, and I'm seeing somebody who is reactive. I didn't say positive. I said reactive to the hepatitis C antibodies. Is that person positive? I'm not sure until I do what we call the hepatitis C RNA testing. That's like the viral load, or an ELISA testing. Why? Because even those people who have cleared the virus will still be showing reactive to the hepatitis C antibodies. That doesn't mean the person is positive. Now, most pre-employment screening, they ask for this antibody test. So you will see somebody who will come and say, oh, reactive antibody for hepatitis C. This person is positive. It is not true. Because even when we have cured this same person for hepatitis C, the person will still be reading reactive to the antibodies, because antibodies will never go away. They are there to protect the body from a future similar infection. You get the catch?
Yeah.
Now for hepatitis B, we're not checking just the antigen. We're checking for antigen, we're checking for antibodies, we're checking if the person is highly infectious, what we call the hepatitis B envelope antigen. We're checking for hepatitis B envelope antibodies. We're checking for those things because those things will help us know if the hepatitis B patient is highly infectious or not, if the person is in the active phase or not, if the person has developed immunity or not. So there are so many parameters that we check on the hepatitis B panel. This information is very, very important. Now, when it comes to whether people are being discriminated, yes, I am seeing it. A lot of people have been discriminated and cut off jobs that they ought to do. Food handlers, they are subjected to hepatitis B and C screening tests, but that doesn't mean that they cannot work there. They can work. Hepatitis B and C are not foodborne diseases. You cannot catch them through food. All you need to do is to make sure that their colleague are vaccinated, especially for B. Remember, I gave you steps you'd use for hepatitis C and B. There are two different approaches.
Yeah.
So imagine this staff is B positive. Everybody there should be vaccinated. Of course, screen and vaccinated. But this staff can still do the work. If I must share my own personal story with you, my support staff, who took care of my baby, they were positive. Not because I'm just an advocate or a doctor. I knew there's no discrimination to B. It's not a C she has, it's B. And my children, they've gotten hepatitis B vaccine. They have immunity. What am I scared of? Right? And it's the same thing I say. If you have if one of your siblings or mother, would you say because they are positive, they should not carry your child? Come on, let's be honest. So we need to be enlightened about this. Hepatitis B cannot be contracted by just shaking, hugging, sitting together. It has to be body fluid. And as I said, through sexual contact, the semen, vaginal discharges, blood, and they must be talking about sweat. Yes, hepatitis B have been seen in sweat, right? But the person who is exuding that sweat must have had a cut. Cases where we manage people who are having liver disease in the hospital. Maybe hepatocellular carcinoma, maybe someone is managing a parent in the facility and they have to take care of the parent. They need to take proper precaution. They need to be vaccinated because that is one easy way many children get the virus in managing their parents.
All right. So in the last episode, when we talked, you mentioned how, sometimes the first phase sometimes can be, treated with just the immune system and all of that. And part of what happened in our comment section was a lot of people referencing herbal medicines and all of that. So what do you have to say about that?
Let me just put it this way. It's not like I'm a Nigerian. We want locally made pharmaceutical products. If you are saying or claiming that your herbal product cures all kinds of diseases, even hepatitis B, I don't have a problem with that. But can you subject yourself to NAFDAC and necessary agencies that are responsible for production or manufacturing of medications? Let them see, because what they don't understand is, most of these new modern day medicines, of course, we know they are all gotten from our roots, our herbs and stuff. No doubt. I agree with you. But what about the dosing? Do you know about what they call therapeutic effects, lethal effects, side effects that can arise from just taking the herbal concoction, which you don't know how it is produced? What about the sterility? You can be treating the hepatitis and be developing a kidney problem. You can be treating the hepatitis and it's causing the diabetes for you. So these are the things that NAFDAC and those agencies that are responsible for this drug manufacturing and stuff, subject yourself to it. Our NAFDAC today has given a lot of herbal medications NAFDAC number. That's because those products have been subjected to test. And there are scientists there who are working on them. So I have no problem with the herbal people, but you must go there and make sure that you ask those people on the comment section that, do you have a NAFDAC number? You will see they say they don't need NAFDAC number, they know it works. No, we don't work like that. We don't, I can't give someone a medication that doesn't have a NAFDAC number. Who regulates you? Nobody regulates you. What's the dosage? Do you know? We've seen a patient, a man somewhere around Maraba. This happened around 2017 as well, 2018. Somewhere around Maraba, this man squashes tenofovir into his native concussion and gives it to hepatitis B patients. And they see that their viral load was coming down.
But they were just taking the regular medication.
They were taking the regular medication with some God knows whatever is inside. And the case was reported to the respective bodies. And they did their investigation and they checked and they saw that the medication contained tenofovir. This man is in Maraba, somewhere in Maraba. It happens. So there are some people are just doing it to make money. And people are being deceived about it.
All right. Thank you so much for coming once again and answering all these burning questions. Hopefully your DMs get a little bit of a rest now.
I should.
And we get to get people can use this information and then make decisions about their lives. Thank you so much for coming.
You're welcome.
Thank you. All right. That's our round of the program. We have been talking about hepatitis, answering your burning questions. I believe you've gotten the information you need. We've answered the questions that we got, quite a number of them. And also, as regards where to get care and all of that, like Dr. David has said, you can go to any government hospital. If they do not have the resources, they will refer you to where you need to go. Also, watch out for July 28th, World Hepatitis Day. There's going to be a ton of free screening happening all over the country, all over the world, actually. So do pay attention to that. And also, Heal Network will be here once again to shed more light on it when the time comes. So these are all the ways you can help yourself, protect yourself, take care of yourself, do well to use this information for yourself. Thanks so much. This has been Untangle. See you next time. I am Amadine Ogbewi.